all these chips like sour cream and onions and all Cheetos and all that, they can affect the teeth. So make sure your child is brushing twice a day, and if they eat anything sweet, brush their teeth. Make sure they brush their teeth extra.
Welcome back again to our page, our platform of Pediatrics to Go. So today we're going to be talking about dental abscess and prevention. Well, actually, that means like having balls around the tooth. I didn't even know that could happen until now, but we'll find out in this video. Stay back and watch. Okay.
Thanks, Francisca. So we're talking about dental abscesses. Basically, it's a boil around the soft tissue of the tooth.
Oh, wow.
Now, when children have dental cavities, what happens is there's different parts of the tooth. The reason I'm talking about it, because I'm not even a dentist, but we do see a lot of children who are coming in at night because they didn't have any way of seeing their dentist, who has probably closed at 5 o'clock. So they come in at 8 or 9 in the evening with their face swollen. And it's like, oh, my tooth is hurting and my whole face is swollen, and it started 2 days ago. Now, most times when children have cavities, it opens up the teeth are actually one of the strongest bones in the body, but they are no match for sugar. So if you have a child who eats sugar and drinks a lot of sugary like juices, hot chocolate, all that kind of stuff, that increase, and especially if they're not brushing twice a day, that increases the risk to have cavities. When you have cavities, it starts to eat away at the enamel of the tooth. And you have the enamel, then you have the dentine, then you get to the pulp, and then you have the nerve. Now, if the tooth has a hole that goes all the way to the nerve, oh my goodness, that's nerve pain. It's like, it's neurogenic pain. That pain can be severe. For anyone who has had a toothache, you know what I'm talking about. So when children have abscesses, it means that there's a bacteria that has gone into the tooth, and most times it's gone all the way down into the nerve, and sometimes it can infect the gums that is holding the tooth in place. So once there's an infection in the tooth that has gone into the gums, the gums start to swell, and they can swell outward where the whole face is swollen. And some of those children, they come in with really significant swelling of the mandibular, of the jaw around the cheek.
Is it the same as mumps?
Mumps is a viral infection.
Okay.
This is an infection of the gums. Anyway, your teeth they're held in place by this is your maxillary bone, your mandibular bone, and then there's gums around it, which is the soft tissue around the tooth. Once there's an infection, sometimes there can be bleeding. If you poke around the soft tissue holding the tooth, you can see blood coming out. Sometimes there's even pus coming out because there's an abscess or pus collection underneath in the soft tissue surrounding the teeth. So when children come in like that, the first thing we do is give them ibuprofen. Ibuprofen is over the counter. That's also Nurofen here in Nigeria. In America, you have your Advil, your Motrin. So you give them that. That helps with the pain. And then most of the time, because we're pediatricians in the urgent care, so I'm an urgent care pediatrician. When we have children coming in, we start them on antibiotics. And the antibiotics usually is amoxicillin. And you want to make sure that the children get high dose amoxicillin for 10 days. People might decide, oh, they don't want to do amoxicillin, especially if they're allergic to penicillins. Then we do clindamycin. Clindamycin is great, especially for the bacteria that can cause those abscesses. And then we usually recommend follow up with your dentist, because if there's any, the antibiotics will help to take out the infection, but sometimes there might be residual pus around the teeth, and the dentist might have to drain it if it's really bad. But as soon as children start to take ibuprofen, remember ibuprofen is an anti-inflammatory and it helps with pain, their face swelling starts to go down, especially when they're on antibiotics. And that swelling usually will be gone in about 7 to 10 days, as long as they're taking the medicine. And then they need to follow up with their pediatrician to make sure that that everything is gone, and with the dentist to take care of that cavity, because that needs to be filled. If they need a root canal, they should go get a root canal from their dentist. But the dentist usually will follow up on the children and make sure that the abscess is all gone, or the pus collection is all gone.
Oh, wow.
So now you know that.
Yes, now I know.
Dental abscess. Now, we recommend children to start seeing their dentist as soon as they have 4 teeth together. That's usually by the time they're a year old. So the teeth start to come up at 6 months, most times. And then once the teeth are coming up, we just recommend parents to clean with cotton balls and water. And then once you have 4 teeth together, use a non-fluoride toothpaste to brush, but have your child see the dentist. Usually from 6 months to a year, they can start seeing the dentist, just to make sure that the dental hygiene is good. recommended usually by the American Academy of Pediatrics to see your dentist at least once or twice a year, so every 6 months or every year. But as long as your dentist is checking and making sure that your teeth are good, you want to minimize sweets, candy,
Chocolate.
those hard chocolate that, those hard candy that are like toffee and children bite into.
Jawbreaker.
Ooh,
particular
those are not good for the teeth. Soft chocolate is actually better because it's easy to clean your brush your teeth afterwards. So stick with the soft chocolate, but make sure your child brushes their teeth after they drink or eat anything sweet. So, and cakes, all this,
Cream, whipped cream and all.
all that stuff that children like.
Okay. Candy.
Even all these chips like sour cream and onions and all
Popcorn.
Cheetos and all that, they can affect the teeth. So make sure your child is brushing twice a day, and if they eat anything sweet, make sure they brush their teeth extra, just to minimize the amount of
Particles left
decay.
over.
Yes, and
the
remove
teeth.
sugar from the teeth, so that sugar and bacteria, they are no match for the strength of the teeth, because teeth are very strong. But once you put sugar on it and bacteria find that sugar on your teeth, that's when the decay starts, and it can be a long road. It's always safer to have your natural teeth than to start doing fake teeth. I mean, some people unfortunately lost their teeth when they were younger, but if one gets into the habit of brushing their teeth regularly and flossing, flossing is another thing people don't do every day, but floss in the night, at least every day, morning and night, or at night, but do it every day. That takes away the bacteria in between your teeth that can also cause tooth decay and rotten teeth. And then the other thing that a lot of parents do, after their child turns a year old, they are still giving the bottle to the babies to drink. That leaves sugar on the teeth, and the next one, the top
Milk carries.
milk bottle carries. Yes,
I
you've
remember.
heard about that before,
Yes,
right?
done it.
So their teeth can start to rot. So
Rot.
once your child is over a year old, if you're going to continue with the bottles, that's not a good idea. But only put water in it, especially at night. Use sippy cups instead, and brush your child's teeth twice a day. Because once they start using those bottles and there's milk in it, especially at night, the teeth, these upper teeth, they get rotten, and then you have to now start going to the dentist. They might put caps, start removing broken teeth, and the teeth can look very horrible. So we don't want that, and we don't want to end up having our children having abscesses just because they're not brushing, or the diet is too rich in sugary stuff. So drink a lot of water. The American Academy of Pediatrics recommends just water and milk, no juice.
Oh.
So juice is actually a treat. Soda, all that, there's no need for that in your diet. If you eat healthy, fruits is actually a sweet alternative, and it's natural sugars versus sodas like your Sprite, ginger ale, Coca-Cola, all that.
I feel attacked.
Yes, you can feel attacked. But if you're going to drink all that stuff, just brush your teeth afterwards,
Okay.
or dilute it with water so that you're not drinking that much sugar. There's a lot of sugar in the regular sodas that we drink. Someone said like 16 cubes of sugar. That's a lot. But whatever it is, it's a lot of sugar. And just always check your sugars in your drink. Even all the waters, taste the flavored water and all. Just drink regular water. That's always best. Because all those flavored things, you don't know who is putting what in there. And it's just safer to stick with the natural stuff. Anything that you can't get naturally, leave it alone. Because anything man makes for you to put in your body is never as good as the original, the natural. If you cannot drink regular water, flavor it with some lime. Go for the natural stuff. When you go for the natural stuff, it's always a healthier alternative. So if you want your lime in there, squeeze some lime in there, fine. And sometimes children will drink if there's a little lime in there. And just stick with the natural stuff, and everything should be fine.
All right, thank you so much, Dr. Sanusi. That was very insightful. So don't forget to subscribe to our YouTube channel. We're on Instagram and on TikTok at Pediatrics2Go. And make sure you turn on the notification button so you get updated with the latest pediatric information. Until next time.